2.
Hi, my name is Christine Alvarez, and today I'll be showing you how to change the central line dressing. So first I'm going to check the physician order and make sure that there's an order to change the dressing, and then I'm going to gather my supplies. So first I need a central line dressing tray, regular gloves, and a mask for my patient. So I'll bring my supplies in, wash my hands, and introduce myself to the patient. Hi, Mr. Smith. My name is Christine. I'll be your nurse today. Can I just verify your first and last name and your date of birth? Okay, thank you. So today I'm going to change your central line dressing, which is over here. Do you have any questions? Okay, so then I would provide for privacy, give my patient a mask. And if there wasn't a mask, I would ask him to turn his head away from the insertion site. And then I will open my sterile dressing stuff. And put my mask on. And then don on my gloves. Now I'm going to raise my bed to my working height. Lower my side rail and assess the site. So immediately I want to observe if there's any redness to the site, if there's any odor that I smell or drainage, and I'm going to take off the previous tegaderm. But first I want to pull the skin apart, make sure it's taut so it's easier to take off the tegaderm. And I'm going to press on the lines just to make sure that it doesn't move. And as I'm taking it off, I don't want to touch the insertion site. So then I would also assess to make sure that there's no crackling. And now I would just throw out my tegaderm and my regular gloves. Now I'm going to open up my sterile field, make sure I'm only touching the blue part of the drape. And then I'm going to don on my sterile gloves. So now I am going to open up my alcohol wipes. And then this will be my dirty hand, this will be my clean hand. So then I'm going to lift the ports and just clean inside first. The new one. Middle. And outside. I want to make sure that I am not cleaning out to in. And then I'm going to take my ChloroPrep, pinch it, and then clean inside to out, and also the lines. And I want to make sure that the ChloroPrep doesn't touch the ports. So now, at this point, I would take off my sterile gloves and then don on new sterile gloves for the Tegaderm. So for validation purposes, we're going to pretend this is new sterile gloves. I'm going to get my Tegaderm, open it, and make sure that the clear part is covering the insertion site, and lightly press to make sure that there's no bubbles or creases. Flip the parts to cover the black, and then take off the paper. And as I take off the paper, I want to make sure I even out the edges. And if I wanted, it comes with another extra tape that I can use to secure the lines onto the patient. So then I'm going to cover my patient. But before I cover them, I'm going to get my label, and I would write the date, the time, and my initials so that the next shift is going to know when to change it. But when I put it on the dressing, I want to make sure I'm not covering the yellow part because that's the insertion site, so I'll put on the side. And then cover my patient. Put the side rail up. Lower the bed. Take off my glove. And then take off their mask first. Put the call bell. Make sure they're comfortable. Take off my mask. And then I would clean up my station. And leave the room. When I leave, I'm going to document any redness I saw or drainage and crackling. I would also document that I used the sterile technique and the time and date.